Hi, this is my methods take two. So first off, I would like to address the questions I got on my previous one. A lot of them were focusing on the inclusion and exclusion criteria for my participants. I didn't explain it well in my first video. So there will be 40 participants, 20 with chronic ankle instability and then 20 healthy. All participants will go through and take the Good and Leisure activity time questionnaire. And this pretty much just measures how active they are during the week. All participants will need to score over a 24, which is just meeting the basic requirements of activity, just so we know that some of the things that we put them through, like the single hop figure 8 test, they'll be able to handle that. So then my 20 participants with chronic ankle instability will go through the ankle instability index and then the CATE, which is the Cumberland ankle instability tool. And this just gives us a good measure of what what issues they're having with their ankle and if it has chronic ankle instability. They will also had to have a history of one or more ankle sprains, which that's all included in those tools that we're using. So that is those questions answered from last week. I'll just go through again and talk about my project a little more. I am definitely more clear on the method since I had my last meeting with Dr. Patton and Dr. Gavin. So my, sorry, I was distracted. My specific aims, I'm going to be looking at joint position sense and sensation differences between those with chronic ankle instability and those without it. I will be doing that by measuring joint position sense at the ankle and the knee, and then also doing a sensation test using Sims-Weinstein monofilaments at the plantar cutaneous part of so at the bottom of the foot. And then also one of my specific aims will be looking at the correlation between joint position sense and sensation to functional measurements in those with or without chronic ankle instability. So seeing if these, if the tests have any relation to how well they do on the functional exams that we'll be giving them. So how I'll be doing joint position sense, I'm more clear on that. I'll be looking at the ankle. Patients will be supine on a exam table with some kind of prop up below their calf, so propping up their leg, or just their foot actually. And then I will be placing them in 20 degrees plantar flexion, and I will instruct them to just hold their foot there for 5 seconds, and during this time their eyes will be closed and most likely they'll have headphones on. And then I will instruct them to go through 2 pumps of full range of motion for dorsiflexion and plantar flexion. And then after that, I will try to get them in their preset position that I gave them, which was 20 degrees plantar flexion. They'll do this 3 times, and then we'll take the average of the measurements. And then we will do the same thing at the knee, but this time the patient will most likely be prone, and they will have a prop under their femur just to prop up that leg so they can give full extension down. And I will have them placed at 60 degrees flexion. Same thing, hold the position for 5 seconds, and then I will have them go through full range of motion twice and then try to place their leg back into the position of 60 degrees. And then 3 trials, and we'll average the scores of how well they got or how far away they were from the actual 60-degree mark. And then for my sensation, we're looking at several places on the bottom of the foot, but the one for sure place would be base of 5th metatarsal. Like I said earlier in my last video, that is the place where your foot hits right before you go into inversion. And so seeing if people with chronic ankle instability have a loss of sensation there at that bottom of the foot, and if that's the reason why, or if it relates any way back to functionality. We will be doing the 4-2-1 stepping algorithm for Sims-Weinstein monofilaments. I have never done this before, but I got a couple good articles that will explain exactly what this is doing. So I know we are definitely using that algorithm now. We're doing 3 30-minute sessions, which I think it will be okay, but it makes me nervous because I know people struggle with just having surveys that take 15 minutes and people not giving them the time. So finding 40 people to come in 3 times for 30 minutes was a lot to ask, but I think it can be done. Let's see here. And I guess that's my update. And hopefully I can answer any more questions that you guys have.